Welcome back to Midday. We're joined now by Dr. Desai.
Hello.
How are you today?
Good to see you.
You too. So we're going to talk teeth again, as we usually do with you, but this time we're going to talk about bruxism, which is clenching and grinding, and TMJ is in there as well, right?
That's
Some association. And even you were saying recession as well, gum recession.
Yes.
So lots of different things that happen when you grind and clench your teeth. It's not good. I used to have TMJ. We were just chatting about that.
Yes.
And then had my wisdom teeth removed, and it helped, which is weird. Why did that happen?
Well, that makes a lot of sense because there's two kinds of habits of bruxism. One is a habit of you kind of do it in your sleep,
right?
And the other is during the day. And the type of symptoms that are associated with sleep-oriented bruxism are different, and they're more dental and musculature oriented. So wisdom teeth plays a role there.
Right. Okay, and I didn't know that the stats were so high. 78% of adults and 50% of children are either grinding or clenching their teeth. So this is a big issue.
This is a big issue, and the misnomer was that in the past it was all stress related. And when you repeat something often enough, it becomes true, and this is definitely a rumor. We all do it, at nighttime especially. Kids, you know, people say, well, what are they stressed out about? It is neuromuscular, their jaws are changing, they're teething, they have earaches, all those things cause TMJ and bruxism. As far as teeth-oriented things, you could have a bite that doesn't quite fit if you get your jaws from your mom and your teeth from your dad, and that's why we have orthodontics. It doesn't quite fit perfectly. And then that can set off dentally oriented bruxism with neurotransmitters of the muscles also playing
So there's lots of factors that play into it. So that's why the stats are so high, because there's so many different things, and a lot of people do it afterwards. So you have a little display for us.
Yes, I do.
Show us how it works.
You know, there's lots of symptoms as we talked about, but one of the definitions we use in dentistry is parafunction, which means non-functional tooth function, meaning teeth can, you know, as we eat, we go up and down and bite our teeth, or bite our food. Whereas if you open and close kind of oddly at nighttime like this, it sets off little trigger points that can go into the TM joint, which is right up here, and then cause all sorts of musculature issues. So this is where your wisdom teeth, or a filling that was recently done, or a toothache of a cavity, it sets it off. So when you continue to bite in a weird kind of fashion, the gums are like, okay, we give up, we're going to recede, or a filling is going to break, or you're going to wake up with headaches that are associated with musculature going to your neck,
headaches definitely were part of it.
Exactly.
So because your muscle's not used to functioning in that way either, so it starts tightening up as well, and then that's where the locking and all that stuff comes in too.
Exactly. And one of the main treatments of bruxism and TMJ is massage therapy to hit those trigger points.
And that helped, but still wasn't 100%, but it did definitely help. So the splints you're saying are a big part too.
Yeah, and this is an average type of splint. There are so many more sophisticated materials out there today, but basically it's treating the symptoms of putting a buffer between your teeth kind of coming together so that the fillings don't break, so that the forces get translated easily and uniformly across all the teeth, as opposed to one trigger on one tooth.
Certain ones, kind
of thing.
And then you're unaligned and all that other stuff that causes all those problems.
Yeah, and plastic is cheaper and easier to replace
than your teeth. Exactly. So we have some pictures as well that you can explain to us what we're looking at.
That's right. So this is just a very early stages of bruxism and wear, where you can see the translucency of those front teeth that you've worn away the enamel, and you're starting to get into the dentin now. And this is severe form of bruxism, where you can literally have a skating rink on top of your teeth.
Grinded their teeth down
ground out everything.
Wow.
Exactly. And this is somebody who has had years of bruxism and wear, has never been diagnosed, and yet they're functioning amazingly well.
Wow.
On little stubs.
Other than they need some new teeth.
Exactly. And this is a patient who had a crown on their tooth and has literally fractured it off.
Yeah, it's actually facing the wrong way, right?
Well,
it's fallen over?
Yeah, it's literally fallen over. We're looking at the occlusal view, which is a helicopter view. But you can wear away porcelain, you can wear away tooth structure.
Depending how severe it is.
Depending, and the duration of the forces. So you can literally get abscesses and fractures because of the forces in the mouth.
That's crazy.
And our chewing forces are so much lighter than our bruxism forces. We touch our teeth maybe 10/10ths of seconds while we're chewing our teeth. Like if you think about it, it's just tap, tap, tap.
Right.
Whereas bruxism is over minutes during the nighttime repeatedly.
Clenching or
Tons
grinding.
of force.
Right.
Tons of force.
Yeah. We have very strong jaw muscles, right?
We
That's
do.
the problem too. So that's why it breaks it down so quickly.
Exactly.
So what's the best thing to do for someone if they are experiencing any pain or they see that they're wearing out their teeth? Definitely get to a dentist right away. And what's the easiest form of treatment?
There are, again, multifactorial, right? You definitely, the easiest way is to treat with a splint because it is completely reversible and no harm done.
Okay.
The other is to get an orthodontic consult. That is vital because if your teeth are malaligned and it's causing these triggers, you need to deal with that.
Okay.
Right? And there's so many patients who should have orthodontics and that don't.
And it just gets worse.
It gets worse.
Get it taken care of right away.
Exactly.
All right. All the info on the screen for you there. You can get a hold of Dr. Desai at kamloopsperidontist.com. Thanks so much for coming in.
My pleasure.
Have a great day.
You too.
Thank you guys. And we'll be right back with more Midday right after the break.